Hello there, Dr. Nagpal from Beena Medical Aesthetics. I'm going to show you how we inject fillers in the penile shaft. The guarantee is that if we do the girth is increased, the length. Sometimes we see some length increase. You do need antibiotic before the procedure and then after the procedure. So presuming this is the penile shaft. Now it is only done on the anterior surface, not the posterior or the lateral. So what I do, that may be a little extra step I do because I don't like to give pain or get pain. So I always apply this numbing cream for about 35 minutes to 40 minutes. And then we wipe it off with saline and alcohol prep. Actually, I do some betadine also. And this way, now I have to make sure the markings don't go away. Now after that, we take lidocaine, 1% injectable, and 25 gauge needle, which is kind of long, so I don't have to keep poking them. And it's done pretty superficial, like subcutaneous. And usually you 5 to 6 mL is fine, because you know that also causes little swelling, so you don't want to give too much. And then you go from, you know, inject little, and all they feel is a little prick. After that they don't, because I do the integrate injection, so I inject this as I go forward. Okay, so inject it like this, here and here. That makes the penile shaft really numb, and you won't feel anything at all. We let it work again, then clean. Then I clean it again with the sterile gloves, not the other gloves. And I also use cannula so that there are not too many prick marks. Sometimes I found the skin is very tough. For some reason, some people have that. And then I might have to use 25 gauge needle, again, a long one, so I don't really give too many pricks, so not too many entry points. And then you go that, we give subdermal, so it's not very deep, but it is deep enough. And this is the filler that we use. It is Versa. And again, you just made a little tiny entry point with the needle and then insert the cannula, which is blunt, and that's the advantage of it not giving too much bruises, also helping with any complications like entry into a vessel, because they kind of push aside rather than penetrate it with the blunt head. And then you go subdermally, just 1 point, and then you slide it down in that plane. It's easy to find the plane, and then you give the injected that. I do retrograde, sometimes integrate, depends on how entry point is and how I really judge. So this is it. The longest it takes is to numb, because you have to numb with the cream, the lidocaine, and then I do this. There is going to be some swelling because we are giving a lot of fillers, not just one. So there's going to be swelling. There could be some bruise. Most probably the light skin, type 2, 3, 1 of course, which is like really light Caucasian skin, they bruise. We cannot guarantee it's not going to bruise. And I've seen in the darker skin people, the bruise is not that much, but that's normal. It takes some time for the fillers to set in. And so don't be alarmed that you see a little bit or more on one side. You have to let the swelling go down, okay? And the swelling doesn't have to be even in every area. Depends on how difficult it was to find the plane of injection. So it is good to keep in touch with the provider. You know, ask them questions, ask them whatever the doubt is, but it still takes time for the filler to settle. The results are very good. I don't do the head. So it's a very specialized field, and also it can cause more complications. All right, if you have any other questions, give us a call.